With us is Dr. Jeffrey Scott, a board-certified plastic and reconstructive surgeon. Dr. Scott, welcome to our program once again.
Great to be here again, as usual.
It's always good to find out what's happening in the area of plastic and reconstructive surgery. We hear a lot about it. There's a lot of programs that I think with more and more of these news magazine type of programs, they're looking desperately for content, and so they look for things that they sometimes can show almost in a shocking sense. Although I think in many instances it is good because they do let people know that, for example, as we talk about board certification being important, that is an important area, the doctor that you select.
Yeah, no, I think in general those shows are good educational things. Sometimes, as you mentioned, they're very sensationalistic, but hopefully they get their point across.
Well, and I think that what will happen, people who are really interested in the procedures that they are showing may be a little more cautious, and they will proceed as I just said, cautiously, and that's an important thing to do.
Absolutely.
Make sure you're comfortable with the doctor you're going to see, and make sure he has good credentials.
Yeah, and I certainly don't. I commonly see patients that will, ask me if I saw the 2020 show last night, and I will occasionally see them, just randomly happen to be flipping the tube before I go to bed, and we'll see a show. And those that I've seen are very good at making that point, and making sure that the consumer is doing their homework and seeing the right person for that problem.
Now, I'm going to mention to the viewer just briefly, we won't go into a lot of detail about this in this particular program, but we always talk about the importance of board certification. You can talk to your doctor and find out what that means. A board-certified plastic and reconstructive surgeon goes through a lot of intensive training, and so it's much more than a weekend seminar where you are getting a certificate and stating that you have some type of a certification. So you want to make sure when you're talking to your cosmetic surgeon that they have that board certification, the board-certified plastic and reconstructive surgeon. You got little arrows in a circle that have become the insignia for that, I believe.
Yes.
Today we want to talk about another one of those innovations. Certainly people have been seeing it for the last year and a half, 2 years, somewhere within that period. And it is a buzzword that gets everyone's interest. It's lasers, and you are using lasers now in the procedure of plastic surgery. Yes,
yeah. And as you mentioned, it's I lose track of time, but it's been used very commonly for at least 2 years now. And the laser, it's kind of difficult to, what we'll be addressing is laser resurfacing or laser removal of wrinkles and that sort of thing. There are certainly many dozen different types of lasers that have many different applications in all fields of medicine, so a lot of people will come and want a procedure done, a nose job, a rhinoplasty, and we'll say, now you're using the laser for that, aren't you? And I think it becomes confusing to people or the patients on what really the laser is used for. Lasers can be used for ridding of vascular birthmarks, port wine stains, removing tattoos, a lot of internal usage, conization for female cervical dysplasia and things like that. So there's a lot of applications for the laser. One of the applications that we as plastic surgeons use the laser for is wrinkle removal or wrinkle improvement.
Now, when we're talking about the removal of wrinkles with the laser, are we talking about specific areas, or is this any wrinkle that one might have?
Yeah, that's a very good point, good question. The laser removal of wrinkles is fairly consistently confined to the face only. The reason being is the face has a lot of hair follicles and has a lot of blood flow, so it tends to heal quickly. So your risk of scarring is much less in the face than in other parts of the body. When we talk about wrinkle removal, it's very with the face. With the aging face, there's a number of phenomena that go on, and there's certainly skin laxity, fatty laxity with droopiness, such as in the jowl area and underneath the chin. Those areas require skin tightening procedures, such as a facelift. On the other hand, A facelift doesn't really address wrinkles. That's kind of the misnomer. You know, doc, I have these wrinkles. Will you give me a facelift? No, facelift tightens things up from the standpoint of laxity, whereas the laser itself actually improves upon wrinkles. I guess that's a long answer to your question. We primarily do it on the face.
No, that's an excellent answer to the question, because that would have probably come up as well, because what you said is very true. People do think the facelift is, I think it's become the common term. If I'm going to get a facelift, they think that's going to correct every problem they have.
Right, right. And that is, as the facial aspect of plastic surgery has evolved over the years. We now have a number of different tools to treat the problem areas on the individual. You know, we do standard facelifts still. We use the endoscope for endoscopic procedures, small incisions to do mini facelifts and brow lifts, lasers to improve wrinkles, which I think is better than chemical peels, and we'll certainly talk about that. So, yeah, a lot of things to correct what ails you.